Assalamualaikum warahmatullahi wabarakatuh, and hi, my name is Ainur Fatia binti Zakaria. I am a student from UiTM Terengganu campus Dungun. Today I would like to present an introduction of informative speech for English for oral presentation subject ELC 590. Have you ever had a case of insomnia? Do you have any idea what insomnia is? Insomnia is a sleep condition characterized by difficulty falling or remaining asleep, and insomnia is an often neglected diagnosis. This may be owing to its high subjectivity, its perception as a condition or of low importance, or even that it is not a medical condition at all. Insomnia, which can cause sleeplessness or waking without feeling refreshed, affects at least one out of every three people at some points in their life. This inevitably impairs daytime activity, causing tiredness, poor focus, and mood disturbance. Insomnia is a common public health problem with an estimated prevalence in both Western and Asian general population. The condition can be called as acute insomnia, which is short term, or chronic insomnia, which is a long term. It can also come and go. It has the potential to influence both children and adults. To support my informative speech, which is the different types of insomnia, I have done some research through a few articles such as what are different types of insomnia, prevalence of insomnia and its impact on daily function amongst Malaysian primary care patients, and insomnia disorder diagnosis and prevention. For the first central idea is acute insomnia, which is a short-term sleeping disorder that can last less than 3 months, and symptoms can disappear on their own as a person copes with a traumatic event that caused their sleeping problems. The second central idea is chronic insomnia, which is a sleeping disorder that lasts for a long time and described as difficulty falling or staying asleep for at least 3 nights a week for 3 months or longer. Any people with chronic insomnia have had sleep problems for a long time. Based on the research that I have done in an article called Prevalence of Insomnia and Its Impact on Daily Function Amongst Malaysian Primary Care Patients, the survey data have been completed from January to November 2007. A questionnaire on insomnia and day tiredness and psychological symptoms as specified by International Sleep Diseases and DSM-4 was prepared by 2,049 adult patients from 7 peninsular Malaysian primary health centers that was assessed by Hospital Anxiety and Depression Scale. The report was supported by Monash University Human Ethics Commissions in Australia and the Malaysian International Medical University. Based on the article, this is the table that I found, which is the demographic characteristics of patient based on different level of insomnia, which is level 1 that we can call as acute insomnia, and level 2 and level 3 that we can call as chronic insomnia. Based on the gender, we can see that female recorded the highest number of patients that have level 1 insomnia rather than male, which are 445 people. And based on age, patient with age 18 to 29 years old, they have a higher number than a patient at age 60 and more, which have 260 people. Based on the marital status, a married patient have 499 99 people, then separated or widow, which have only 54 people. Uh, for the for the household income, the patient that have 1,000 to 2,001 ringgit of income have 266 people than the 4,100 to 5,000 income of patient, which have only 28 people. For the employment status, the employed patient have the higher number than the pensioner, which is 582 than 44 people only. For the educational level, secondary student or patient have a higher number of patients that have level 1 insomnia, more than the patient that never went to school, which is 386 people. So the analysis is the most high figure that we can conclude in this table were recorded by the employed patient, which have 582 people. For the most low figure were recorded by the patient that never went to school, which have only 24 people. So most people with any form of insomnia indicated poor sleep quality. Many with insomnia symptoms show severe sleepiness during the day more often. Insomnia patients most likely to experience neurological problems including annoyance, anxiety, and depression quickly. They also indicated a lack of focus, like feeling drained, and memory was weaker. So they feel less productive with their poor fitness. For the second main idea is for level 2 and level 3 of insomnia, which we can call as chronic insomnia. So based on the table, as we can see, female have higher number than male, which is 344 people that have level 2 and level 3, which have level 3 of insomnia, which is chronic insomnia. And the patient at age 18 to 29 has the higher number of patients that have level 3 insomnia than the patient at age 60 and more, which have 178 people, 78 people. Next, for the marital status, the married patient have the higher number than separated or widow, which have 375 people. For the household income, patient with 1,000 to 2,001 ringgit of household income has the higher number than the 4,001 ringgit to 5,000 ringgit of household income, which has 212 than 18 only. For the employment status, the employed patient have the higher number, which is 390, and the educational level, which is the secondary student, have the higher number than the patient that never went to school, which is 286. For the analysis, we can conclude that the most high figure in the table was recorded by the employed patient, which have 390 people, and the most low figure were recorded by the patient that have 4,001 to 5,000 ringgit household income, which has 18 people only. The increasing prevalence is most likely due to physical or mental health problem underlying the primary care clinics. Most insomnia in primary care clinics has comorbid symptoms according to many studies. The word comorbid insomnia had been introduced after the conference of the National Institutes of Health (NIH) in 2005. Insomnia caused by combination of mental illness, physician or health conditions, drugs, and chemical substances such as caffeine. Caffeine is a combination of comorbid insomnia. Based on the table, it shows the demographic characteristic with different level of insomnia, which is level 1, level 2, and level 3. And this condition has different types. that not many people aware about, which is acute insomnia level 1 and chronic insomnia level 2 and level 3. Awareness of this condition are very important for Malaysian society to reduce the number of people that having this condition for a better life in the future. For the recommendation, what people can do to avoid or reduce sleep problem or insomnia, which they can keep their sleeping cycle regularly. And second, can check your medication, whether you take your medication daily, so you need to talk to your doctor about what they about if they could be causing your insomnia or not. And you can also check the packaging on over-the-counter drugs for caffeine or other stimulants. And next, you can find ways to relax. When you go into bed, try to set your fears and plans aside. Before going to bed, you can take a warm bath or have a massage to help you relax. You can make a bedtime routine for yourself, such as taking a hot bath, reading, listening to soft music, doing breathing exercises, yoga, or praying. That's all for me. Thank you.